Hi, it's Gord from the Conversations of Substance podcast. I'm here today with Dr. Vera Etches from Ottawa Public Health. She's the Chief Medical Officer of Health here in Ottawa, a friend of CAPSA, a friend of our community, and a leader on all things health related. So nice to see you, Dr. Etches.
Thank you for your interest.
So we wanted to get together, we're having a conversation. There's some important changes here in Ottawa that I really wanted to notice if I can and get your thoughts on that. The priorities that were set for the Ottawa Public Board this year, mental health and substance use health. That's something new.
Well, Gord, you know that we've had to learn from you and your team at CAPSA how to talk about substance use in a way that doesn't continue to perpetuate stigma. And I'm sure we could talk more about stigma, but I want to thank you because you did introduce us to this term, substance use health. And so the idea, as we've learned, is that we talk about mental health, and we know people with mental illness, with a diagnosis, can still have health. And we promote mental health. We promote the well-being of people living with mental illness. And the same can be true with substance use, right? People living with substance use, whether you have a diagnosed substance use disorder, whatever the substance use, you can have health. And so that's our goal. That's a common goal we have to promote that well-being of people, whatever their use.
And I think that's, I'm pretty excited about that, and the country's looking forward to that. People who use substances are looking forward to that, to be able to enter the conversation about my health without the presumption that it means I'm not going to use substances anymore. I think 80% of Canadians will use a substance next year.
Yeah.
It's about time we just said, yeah, that's true, and that's not going to stop. But people's health is always a concern for Canadians, and so thank you very much for your leadership on that. It's one thing for people who live the living experience to have these ideas and perspective. It's another thing when community and health leaders join us and stand beside us to lead that. So, thanks.
Well, it's the way we want to work to be effective. As a public health agency, we have traditions and approaches that aren't necessarily always on the right track. As needs of the community evolve, as science develops, we need to change how we're working. And so as a leader for Ottawa Public Health, one of the things I'm making sure we all understand is it's quality work. It promotes quality and effectiveness when we work with people who have the lived and living experience that can inform approaches and inform programs. So we need to bring what we have from the science world and how we look at the population's health, how we can measure health, but it's not all the information we have to inform the best way forward. We need to use all the information from many different places.
I was thinking back just now to the first Ottawa Community Action Plan. That idea that you had to bring people together and ask the community, what are the priorities? And so, if I don't have to remember, I know that the number one priority was stigma. And, can you see how that developed over these last couple of years from that conversation to this one?
Well, I think that it's been reinforced. Again, the stigma meaning that people who are using substances are not always feeling that they're treated respectfully. They're not treated respectfully. That there's some aspect of shame often that people feel because of the kind of attitudes that are prevalent in society. And this is being uncovered as wrong thinking and harmful thinking. And so I've seen you, again, and CAPSA really lead in helping to make the science of substance use and what it means to have substance use as a health condition where there are reasons for substance use, there are changes in the brain that occur. These are not all just choices and values that people have around substance use. It's complex to try to help people understand and move away from that judgment. And so I think compared to when we first looked at an action plan and said that addressing stigma needs to be a priority, the first priority. I think that's been reinforced, and I think we've seen tools develop to help people understand, to foster that learning. You've been working to help healthcare providers understand, because in our healthcare system, there's stigma, and people don't come forward and aren't accessing the treatments and the help that would make a difference. So I think the other thing is we've just seen how harmful it is. The deaths have continued to grow, and that's because often people are alone, not able to talk to someone, and not feeling comfortable to talk to healthcare providers. And that has to change, because there is help, there are solutions, and part of the solution is often talking to someone and the people around you. So that's, we've got to keep going on that.
Yes.
Yeah.
No, there's a white horse out front we can get on and head off, and But I think very much, that idea that there is places to go, and this is not over yet. It's very beginnings, and so as we celebrate the progress, we also recognize how long the road is ahead. And the community is the answer, I believe. And so there's leadership, there's engagement, and then community members as a whole. What do you think Ottawa, people living in Ottawa could do next?
Yeah, I do see some challenges right now of still that lack of understanding and that sense of blame for somebody's actions and outcomes when substance use is causing harm to others. And so I think that we need to continue to build understanding about what the root causes are for substance, to foster compassion and help people, rather than judging, be part of the solution in terms of not excluding people, not turning away, but including. And so I think all of us, it's true, all of us probably wherever we are encountering people, we can take a look at what kind of language are we using. What do we know about people's backgrounds, the supports that they have or haven't had? Often we are talking about trauma that people have experienced in childhood. And I think if people were coached and supported to recognize and think back to everyone is a person and a child at some point, that compassion could grow. I see it missing in some situations. And I also see sometimes there's misperceptions about substance use in terms of it's not a problem for me or my family. Often there's the stigmatization associated with people who are without a home or on the street, and that, again, we need to work on building understanding and solutions. But also in places where the substance use is more hidden, that we need to be able to check in with each other, and ask and open the door for people to really say how they're doing, and look for those red flags. So some people also don't know what are the guidelines? What does the science say about when your health is starting to be affected by substance use? We have low-risk drinking guidelines. We have low-risk cannabis guidelines, and sometimes when people hear about them, they almost don't resonate because it's normal. A lot of the harmful patterns of substance use have been normalized. So again, finding ways to have a conversation like, well, how is that going for you? I think we need to, again, there's tools to help with starting those conversations and building understanding.
Well, and I think the idea again around substance use health was that if I can just ask you or ask my GP, by the way, here's my experiences. You see anything around that? Two things have to happen. My GP needs to be able to have the conversation with me, needs to have that information. But also I need to know that you're not going to diagnose me immediately on the far end of the scale because I mentioned my substance use. This assumption that if I'm going to examine my substance use, I must be over here. is what blocks a lot of people from ever having the conversation, you know. This is a little sensitive, and we'll just kind of see if this one works or not, if that's okay. The great irony for me is we did an outreach to the Ottawa Police Services Board 5 years ago, and I went and I said, I'm here to help. Here to help police service members, sworn and unsworn, who struggle with substance use. And there's this sort of quiet period, you know. Here we are 5 years later, and the Ottawa Police just made mandatory training, stigma training on substance use by the end of this January 2022. That means more Ottawa Police Service members will have taken stigma training than the rest of Ottawans since we started this work. It tells me a couple of things in my mind. Number one, the recognition that all police service members do actually suffer from this. That we must approach everyone on this issue and raise this question: do you not know someone? And what are you so afraid of that you need to push down on us to feel better about you?
I think that my experience with the Ottawa Police Service is that there has been a tangible shift in understanding substance use as a chronic health condition.
Yes.
Where other solutions are needed besides going down the criminal path, right, of charges. And, you know, the science bears that out too. Healing probably comes from being incarcerated. So, that's joint work we need to do to change the pathways.
Absolutely.
And so what you're describing as internal training will surely, continue to foster, looking at how do we divert from the criminal system. There's work to create those other supports still, right? So we just don't have the access that we need still for alternatives in the moment of crisis. But people are calling for that, and people are working on this, and I'm sure that we'll continue to see progress. I think Gord, like the healthcare system is made up of many different organizations. There's no one person in charge, and I wish, sometimes like the people look at me, can't you change that? But together we can. Together we can foster more coordination, and we're seeing this through designated services now called like Access MHA, Access Mental Health and Addictions. There is one place to go through, and so beyond this access, and we do need more 24/7. We need more evidence-based approaches sometimes. What's behind the door.
Yeah.
We can strengthen the science-based approaches to get people support, because we know there are things that work. So let's keep going.
I think we're in a great transition time between the recognition that these services aren't in place, and sometimes there's services there, but they're not the right services. And the past behaviors and societal decisions that were based on stigma, And when you put substance use health on top of that, you look and say, is that helpful? Is that increasing health? And all of a sudden you go, well, no. Okay, well then let's stop that. All right? We don't have to make up names about what that is. We just put the lens on. And whatever that is that's not working, supporting people's health, well, we'll just stop that. And what is supporting people's health, well, we can do more of that.
And I think too, a key in the Ottawa Community Action Plan, first is address stigma. The second and third parts are about, let's meet people where they're at more. The second focus on harm reduction. So when people come through emergency rooms, or they come to their family doctor, or they're in hospital for another reason, we need to acknowledge the whole person. And if there's substance use as part of what people need support for, we need to have those services right there. And then the third area of focus being integrated service. And this also was loud and clear from the community, right? People said it's not just integrated like when I'm needing support for depression, I must be able to get help without abstaining from all substance use. I mean, we've got to have that, but it's also okay. And what would really make a difference for me is being able to buy groceries and have a roof over my head. So that social service aspect, I'm quite excited, Gord, about the city stepping more into recognizing, even though they're not a healthcare provider, the city can support health through their community safety well-being plan. This is coming with a focus on mental health and substance use, but also housing, also racism. You know, there are populations who face greater barriers, and I think the city's turning their attention to this. I feel quite hopeful that that integration of social services and health will grow.
Well, and there's this idea that I have in my head that people living in Ottawa will be healthier when the city we live in is more compassionate and caring for everybody, more respectful for everybody. And that not the issue of what's wrong with the people that are living homeless lives, but what's wrong with a city that allows people to be homeless.
I think there is a challenge sometimes, and I sort of alluded to that. I see a gap sometimes in how people are viewed when there's conflict, disruption on the street, and it's somebody who's homeless, and the businesses are finding this is affecting their ability to pay their rent and make a, you know, I think part of what maybe we haven't found the perfect way of going forward is addressing there are some harms from substance use, and the compassion that would lead us to finding better solutions. Like, so this I'm hopeful. I think we can find a way through where we do acknowledge we have to minimize harms to communities from substance use, and that means working effectively with people, understanding where people are coming from when they are using substances and having challenge.
I think that's a really important part in there that I know in my own experiences. There are people who suffered from my illness, suffered from my substance use. There were stuff, it was a true story, right? They don't experience that anymore, you know? And when you take a lot of those things away, and it's not necessarily about abstinence, it's about seeking, it's about compulsion. It's about the inability to make healthy choices. It's about having enough to eat so your plate doesn't look better than my empty plate. It's those minimums of decency that we have for each other that if, you know, I'm not likely to see you as on my side if I'm outdoors and you're indoors ordering a meal. Right? Yeah. You know, I may have some rationalization available to me about why you can afford to give me what's in your pocket. And it's that piece, right? The gap.
So you're right. It's basic human rights and human needs that need to be met, and we can do better. We can do better.
Absolutely. And when the COVID-19 first started, I had this expression that even as we learn to cover our cough, we're uncovering our stigma and discrimination.
I hope so. I feel that personally. In public health, we think about the determinants of health. So why does someone end up having, you know, really good health and somebody else's well-being is suffering? Well, the determinants of health tell us a lot can begin in childhood. It then affects your education, your income, your housing. And we always had racism on the list. And what I'm seeing through the, you know, the obvious difference in how people are affected through the pandemic is I kind of think of racism differently as a root cause of some of these root causes of poor health. That we really have to look at everything through this history that we have of colonization and treating people differently based on their background and ethnicity. So again, we need to learn. As Ottawa Public Health, I need to learn. And I think it can be transformative when we recognize the things we've done, the systems we've built, the way we approach things. They're based on some assumptions at the deepest level that aren't giving fair outcomes.
Absolutely, and it's an uncomfortable conversation. You know, I think people, a lot of people living in Canada really have an attachment to our sort of a world reputation of being overly polite. And then you say, well, what about racism? What about indigenous colonization? What about ongoing harms? And I'm not talking 100 years ago, I'm talking yesterday, I'm talking this morning. It's like, well, what about us being overly polite? It's a nice story, but maybe we need to examine our story and take a little deeper look at how are we with people, you know, and maybe hear from them.
It calls us to more listening, absolutely, and more involvement, and truly, as I mentioned, your expertise in shaping how we work. We need the expertise of a very diverse population in Ottawa.
We really want to stand beside people, you know, and I can share an embarrassing moment. You know, I remember being the loudest feminist in the room in my mid-20s, and someone sitting me down and explaining that that wasn't actually supportive. That might be the problem, right? And so I really do see us learning from community how to stand beside. We might not know what's best, eh? In fact, I'm pretty sure we don't. But our community members can inform us, and we can become allies, and we don't have to be perfect. We can check in.
Keep learning.
You know, I'm the same way around substance health, and the same way around language. You know, we're not asking for perfection from our community members, but if they're not checking in, we might have to mention it to them. You know, and we prefer it's just check in.
You're kind of speaking to the idea, Gord, of some accountability, right? Some accountability to keep seeing some progress, to see that change that needs to happen. And I would say that's another thing we've learned out of the pandemic. People loved our dashboards. Okay, so for Ottawa Public Health, we have dashboards on how much COVID is there, how many hospitalizations, what's going on with the testing and the vaccination, and it's beautiful, it's updated every day. I mean, I don't think it's healthy to look at it that much, and we got to scale back, but we can do the same. You know, we should be thinking about what's the dashboard, and we're working on it, but we need to work together. What's the dashboard for mental health and substance use? What's happening? You know, sure, you know, we have hospitalizations, but we're trying to find the ways to measure the well-being too. So you're using substance, but how's it going? You know, we can't. No one number tells us the whole picture. That's also what we learned in COVID. You can't base everything on test results because that doesn't tell the whole story. So we need to create these dashboards that help us see, are we making progress in a comprehensive way? We need to look at the equity.
Yes. Our
different populations, you know, with COVID it was Black populations experiencing more harms. How do we show that, work with the community to interpret that? So again, the numbers are one thing, it helps accountability, but you need, just like we started with, you need the other knowledge of what's behind the numbers. What's the whole story? What's going on? Why are those numbers like that? And so I'm quite excited that we will be able to build something like this that helps us across Ottawa, not just Ottawa Public Health, but as a community, you know, make sure we keep going and improving. Yeah.
It really reminds me of an awkward conversation I had. As you know, I had a bit of a difficult past, but I remember a partner telling me that she didn't live with my intentions, she lived with my actions. And so we know the intentions of most people living in Canada is to have an equitable society. We need to take a look at our actions and take a look at the outcomes around our actions and keep that measurement going. And I want to share something with you this morning at 6 o'clock. I took a look at the dashboard you're developing, and I was so excited that I couldn't help but write your team and let them know that I see so many documents that are like just harmful for me to even look at. It just brings all that. And I looked at this document and I thought, look where we've come to. Ottawa Public Health has sent me this document, and I'm just all happy. It's just so wonderful to see the language, to see the concern, to see the depth of understanding. And I just kudos to your team and kudos to yourself, because that's the true partnership. When change is taking place internally, and we're not working as the language police over here. We're
Well,
so learning has happened.
Well, thank you for continuing to read our documents until we got things right. You know, that cycle of feedback is so valuable.
Yeah. Well, and I hold it up as a shining example to others, right? That the responsibility of the others is to learn so that when they communicate, it doesn't come out as, does this hurt you very much? You know, and we get a lot of that in our work. We get people sending us stuff, is this hurtful? It's like, you're supposed to learn what's hurtful and stop it. And we're more than prepared to teach people how not to be hurtful. But we don't want them guessing with us all the time at a certain point, if that makes sense. You know, that's that, you know. Yeah. And I, on a personal basis, right, it becomes adversarial, right? You become finger pointers, and we don't want to be finger pointers.
No, I you know, talking about it at a personal level, though, I would say that relationships are the other key besides the data. You know, in terms of being accountable. When you have data and you can measure progress or not, but when you have relationships that are real, you can hear when people have to tell you something.
Yeah.
And you have the commitment to work through that and carry on in partnership. I'm from a small town, and so I remember my dad, and I have a privileged background. My dad was a family doctor, you know, helped me, of course, in my life. But I remember him saying, in a small town, you have to find a way forward. You can't have someone you're working with and things go wrong and then you just never see them again. You have to keep going together through the tough times, the conflicts, and find ways of working together. So those relationships can be created in bigger cities too, that really then that, I think, brings that understanding, helps foster that compassion that we need. So this, again, you know, trying as an organization to find ways so that we're not just in the office, but we're building those relationships to be more effective.
Well, I think that's so crucial. You know, if you're going to learn from racialized community members in town, then you have to hear things that aren't comfortable. And if you start explaining why that's not what was intended, you're not really listening, right? And so these are critical components in building allyship and making change here. Speaking of change, I have a little banner here. We can just hold up for a second. And so we've been inspired by public health in many ways. And so we had Recovery Day for the last 8 years, and then we had our last one this year. And we introduced the WOW Festival, which is working on wellness. Imagine.
Working on wellness.
Wow, now there's something we're celebrating. Mental health, physical health, and substance use health under one tent, as if we were whole people. And so we're looking forward to next year, community partners coming from across the breadth of that, you know. I'm thinking about the nutrition department coming, and you know, this is all about everything and just having better lives and being able to talk about that.
And showing the successes, showing what's working, celebrating that. Like you said, it makes sense to focus on what's working well and then build that, make it bigger.
There we go. Okay.
Okay.
Any last thoughts? I mean, I have a big thought. I'm always just so appreciative of your leadership these last couple of years during the pandemic and the humanity and compassion you brought to that issue amongst all the other stuff.
I continue to be pretty concerned that we haven't found an effective way to reach people in their homes, middle-aged men in their homes.
Yes.
And so, you know, one of the ways, you know, that we're thinking of building, making much more effective is working with the construction industry, because that does stand out as one of the most common employment sectors for people who aren't getting the help, you know, that they could and ending up dead. So yeah, just always interested in thinking about what could we do to better reach that population, because it seems we don't have an effective interventions yet.
Well, and You know, my own thoughts, of course, is that, you know, it's the population that doesn't identify with supervised consumption sites, right? And see some stigma around that, which is coming from the society, right? The idea. And it's already pre-isolated. They are living alone, you know, and so it is that, and that social connection is so important. And I think when people living in Ottawa, people living in Canada begin to understand that some of these ideas that we have are hurting people up to and including the point of death. Even if you don't change your opinion of us, could you wish us not to die? Would that be okay? Could we just get to there?
I would think so.
I would think so.
Yeah.
I really don't think Canadians are that harsh. And so I think this is unknown, you know, and I think the typical little person living in Canada just needs to realize that they are a little bit a part of that.
Well, I think it is the focus of our first pillar in the Ottawa Community Action Plan. If we are successful at building understanding, countering stigma, it should reach into places where people aren't connected, aren't getting those supports. Yeah.
So, looking forward to work up ahead, and looking back at a great change and partnership with Ottawa Public Health and yourself, Dr. Etches, and shout out to all the community partners from the Ottawa Community Action Plan, and looking forward to your remarks March 9th.
Okay, yeah, it certainly takes all of us. There's lots of work to do. I'm really thankful for your partnership, Gord.
Okay, thanks.